Okay, here we're going to take a look at how to place our limb electrodes on our legs. Again, we'll be using the snap electrodes. You can use gold-plated electrodes. It's just going to depend on what your facility prefers to use. And it's very important that we do a very good job prepping on these. With women's legs, since they shave their legs, it's harder to get a good impedance on them. For our legs, we're usually trying to get it under 10 ohms as opposed to 5. But you still need to get a really good connection. This is why it's important that patients don't put lotion on their legs before they come to the sleep lab. And men, you have the lovely challenge again of trying to get through their leg hair. So you find their shin bone, which is right here, and then you're going to come just lateral to that, and you're going to look for the meaty muscle here. And in some people, you maybe don't see it right away or feel it, so you might ask them to flex their toes back towards their head like so, and you can kind of see that muscle pop out. And so what you're going to do is take your prep, and I'm going to prep a site right here, and like I said, you got to prep really good. You really got to rub, and your patient needs to hold still for you when you do that.
Sorry.
So now that's my site here, and then you're going to go about 2 centimeters away and do another side, like so. Really scrub. Then go to the next leg, and you're going to do the same thing. Flex your foot back for me. Feel for the shin and then the meaty part just to the side. And again, one side. And most patients aren't quite, this one I got a little high. Most patients aren't quite so ticklish. Some people like to mark their spots with an X so they can see where they prepped. You can kind of feel it too. And a little alcohol, kind of clear it off. Yeah. Okay. Then you're ready to apply your electrodes. And again, with these snap, you're just going to peel off the back. Find where you prepped and stick them on. Again, about 2 centimeters apart. So on your sleep system, when it's measuring the activity and these points, it's measuring the activity between these 2 points on that muscle. So it takes very little muscle activity or movement on the patient's part for it to register on your sleep machine. And then if she was in pajamas, which she's not, I would have her slide these up through her pajama bottoms or her shorts. Then I would also have her string it up through her top. Now I usually don't put my respiratory belts on until after, but for video purposes I actually went in the wrong order because I haven't had to do this in a while. But you're just going to string them, oops, I'm pulling on the wrong one. Geez, sorry. Pull these up. Okay, stop. Alright, and then I'm going to show you what we're going to do with this little extra here in a second. Then we're going to do the same thing on the other side. But one of the things we want to do is make sure these electrodes on the legs aren't going to come off at night, especially if there's somebody who kicks an awful lot, which people with severe sleep apnea, they tend to kick a lot. So what I'm going to do is I'm going to make a little loop in my leads and my wires. And then I have a piece of tape, and I'm just going to tape that lead down, okay? That way, if she kicks a whole bunch at night, it'll pull on this, and it'll break the tape, but she'll have more room to move. So it gives a little slack in the system. Then you do the same thing on the other side. And that's how you do your leg leads.